We have the exclusive data from the government of Saskatchewan on gender-affirming Rainbow 2S LGBTQIA healthcare for the last 5 years. And ooh, buddies, it's not good. Hey everybody, I'm Lise Merle, and a few months ago, Rebel News submitted a Freedom of Information Act request for records showing age breakdowns of surgical gender-related interventions. What the document shows is a pattern of abuse, a staggering waste of medical resources, and an alarming rise in procedures, including on Saskatchewan children. Let's break it down. Excision of the reproductive organs by way of a surgical hysterectomy for girls or an orchiectomy for boys are available to kids 19 and under, but precise numbers were redacted for confidentiality. By the way, this is what an orchiectomy is.
We follow WPATH guidelines, and because this is an irreversible surgery, once the testicles are removed, there's nothing you can do to replace them. The biggest issue with orchiectomy is bleeding. If there's any bleeding in the scrotum is such soft tissue that it'll just keep bleeding and bleeding and bleeding until the scrotum is quite enlarged.
Mastectomies and nipple reconstructions, that is, the excision of healthy breast tissue for children under 19, totaled 99 surgeries in 5 years. The thing gender activists claim isn't happening not only happened, but it happened 99 times. For the record, 1 is too many, but mutilating the healthy bodies of 99 young women and teens qualifies as a proper medical scandal. For adults, it's even more stark. Hysterectomies, which remove the female reproductive organs for women who think they're men, climbed from 7 to 32 over those years. Mastectomies and nipple work, which includes breast implants for trans women, skyrocketed from 23 up to 63. Total excision of the male genital tract or male to female bottom surgery has been redacted, but yes, hollowing out one's manhood to make way for female anatomy is a box you can check as an option on Saskatchewan's free healthcare menu of readily available services. Grand totals were redacted by the government, but we were able to get some numbers, and they signal a massive delay of healthcare services for others on wait lists. Tens of millions in wasted resources contributed to facility overcrowding and have disproportionately added to the burden of pharmacy, nursing, and other downstream healthcare providers. Anyone with eyeballs can see the trend, a massive increase in procedures. And who would support this? The insane woke left. They think nothing of mutilating healthy bodies on demand, and yet they wonder, where did the breast health services for Saskatchewan women go? Reports of long wait lists for breast imaging and diagnosis, women needing corrective surgery only to be given the cold shoulder, and no care for post-breast implant syndrome or detransitioners, and all of this despite solid recruitment efforts by the government of Saskatchewan. Health sector resources have never been stretched thinner, yet in Saskatchewan, we have our priorities upside down. Women needing cancer care and hormonal replacement therapies are hard-pressed to get them on account of the men with fetishes and the unstable young people brainwashed to believe that chemically castrating and dismembering themselves is the only way to happiness. Why is this? The women and children of Saskatchewan deserve the very best, and they are not getting it because gender has been prioritized. DEI healthcare has been prioritized. Keen Rebel viewers already know that Saskatchewan has 9 members of WPATH. This is the World Professional Association for Transgender Health, a network of ideologically captured health practitioners satisfying a truly deranged political movement. What you may not know is that in Saskatchewan, gender-diverse people have unlimited access to federally funded Trans-Sask Health Navigators, which tracks affirming healthcare pathways, including surgery referrals, hormone therapies, mental health care resources, legal, name and gender changes, community supports, and more. Oh, excellent. You know who doesn't have that kind of access? The rest of us. You'll remember what we warned about on the Rebel Roundup back in August when Chapel Rowan name-dropped Saskatchewan and put us on the map for all of the wrong reasons.
Chapel Rowan finally released the first official teaser for her upcoming single, The Subway. A short video clip shared to a fan page shows a white box truck with a crimson-haired driver puttering along the sort of road familiar to anyone who grew up in the Canadian prairies, as Rowan sings,
It signaled that we are a safe space for refugees and Qs, and the stats confirmed it. The numbers provided by the government of Saskatchewan suggest that we've become a regional hub for sex-rejecting surgeries, including on children. Is that what we want to be known for, Saskatchewan? Non-residents are included in these counts, making Saskatchewan a tourist destination for unnecessary surgeries, just as we predicted. Now that we all know that gender-affirming surgeries in Saskatchewan have tripled in just a few years and how many resources they're gobbling up, Saskatchewan's only choice going forward is to decisively stop these acts of medical barbarism and resource abuse with the notwithstanding clause. Again, if necessary. And it is necessary. Pathways and access to these procedures accelerated without clear public understanding nor a full and honest debate. And right now, Saskatchewan has an opportunity to ensure medical pathways are guided by common sense and to make the best available use of our resources. An opportunity to end what this really is, DEI-driven healthcare. After all, in 2023, when Saskatchewan was given the opportunity to act on questions of names and pronouns with the Saskatchewan Parents' Bill of Rights, it did. We have that same opportunity now to ensure that we're prioritizing women's access to care and protecting children from irreversible decisions made before they're ready to fully understand their consequences. We have the opportunity to act early rather than later. From the wilds of Saskatchewan, for Rebel News, I'm Lise Merle. If you appreciate this kind of evidence-based independent journalism and want to see more of it, your donation today will make all the difference. Visit rebelinvestigates.com.